right, Dr. Julie, thank you for joining me today on the Happy Whole You podcast.
Thank you for having me. I appreciate being here.
Well, when I came across your work, I was very intrigued, and I know my audience will be intrigued as well. You do some very important work. But before we dive into that, can you share with everyone just a little bit about yourself, who you are, and how you got to the position that you're in today?
Yeah, thank you. Yeah, my mom suggested when I was a teenager, when I was trying to figure out what to do, she suggested, why don't you be a nurse? And I gave it some thought and went with it. I applied to nursing schools right out of high school and got in. And it's been a 45-year amazing journey. So the first 30 years I was at the bedside or in the helicopter. I spent 10 years as a flight nurse too, but directly taking care of patients in the ER or the trauma center or the ICU. And then for the last 15 years, I've been in nursing education. So leading universities and directing schools. But really, this all came about, my passion just kind of grew over time about patient safety. But most importantly, when I started my master's research into my thesis and then my doctoral project on patient safety. And I think what was most shocking to me is that I'd already been a nurse 30 years. I had no idea. Had no idea medical error was the third leading cause of death. I had no idea how many different ways patients can suffer harm in the healthcare system, because we never talk about it. You know,
Yeah.
it's probably one of the worst kept secrets or best kept worst secrets.
Yeah. Yeah.
Yeah.
Yeah. It is pretty. It's very alarming, and most people don't know that it's the third leading cause of death in the United States, to heart disease and, I think what is the second one? Cancer?
Cancer, yes.
Yeah, yeah, so it's heart disease, cancer, and then, and that's with, uh, proper care too with pharmaceuticals, is that correct?
Mhm. Yes. Yeah.
Yeah, so it's wild to think that, that there is such a risk when it comes to our health when entering, the medical system because it has been such a trusted system for a very long time, and I think people are actually now waking up to the fact that, one, it's not the only way that we can heal, but then also that there's errors just like in any business and anything that we do, there are risks involved. So share with us a little bit more about so you go into your doctorate program, you're going to be working on your thesis, and you've already spent decades of your life in this industry, had no idea that this was the third leading cause of death in the United States. Like, what was that like for you as you started to uncover that? Was like, what was going on? Because that's like a shock, I would assume.
Yeah. So during this time, I started teaching nursing students. I took them to the hospitals and I was teaching in the classroom and in the simulation lab. And I kept what the most meaningful examples of how to safely care for patients was to give them examples from what I found in the literature and the journals about the stories of patient harm, because those hit your heart. And those are the things that students would remember in the given situation if they're caring for a patient that has these kind of symptoms, or they say, or their family says something to them. So I decided, because we don't really learn as consumers the healthcare system except when we're in very vulnerable situations, whether we're having surgery or have an illness that brings us to the hospital or our family members. We're kind of at the mercy because we don't really know anything. So that's why I wrote my book that came out about a year and a half ago, Surviving Your Hospital Stay. I designed it so that patients could read a chapter and learn how to pick a good hospital. I know that sounds funny because we would think that all hospitals would be equal, but they're not. Did you know that there's a website, hospitalsafetygrade.org, where you can actually put in your zip code and find the hospitals in your area and see if they're rated just like college or high school papers or grades, A through F.
Oh,
So,
wow, interesting.
yeah, it's based on 22 categories of patient safety: infections, blood clots after surgery, respiratory failure after surgery, how the doctors and nurses communicate, leaders, and all those indicators. And it's a nonprofit organization. And it really can tell you, wow, that hospital is only a C.
Yeah.
I would rather go to A or B hospital. I have better chances of coming out on the right side of healthcare, right?
Yeah. And how is this tracked? Is this like, you know, I know with a lot of things in the medical field, it is self-reporting, right? Like I have clients that I see quite often that have injuries from vaccines. They've had reactions right after getting a vaccine or right after taking a brand new medication that they've been prescribed or, whatever. And the first thing I ask them is like, have you gone back and told your doctor? And some of them, yes, I've told my doctor. And then it's always, okay, was that reported? I know my grandma had a situation with a vaccine as well. And I talked to my mom, and my mom tried to go through the stages to make sure it was reported. So I feel like there's a lot of underreporting going on just subjectively, just with the experiences I have and the people that I see. So with these hospital ratings, is this self-reported? Are these people going in and looking for things? Like, do you know how this is reported?
Yeah, it is self-reported, but if they choose not to, the CMS, or Center for Medicaid and Medicare Services, has data that they either reimburse or penalize hospitals for performance. And a
Yeah.
lot of those metrics are used. You have to report how many cases of MRSA or Clostridium difficile, or other healthcare acquired infections. You have to report that. And
Mhm.
so that information it's all public information, public data, but people really don't know where to look for it like
Yeah.
you. Like, I didn't even know I could.
Yeah. Yeah.
So,
Oh, wow. Yeah, that's like super interesting. Okay.
um,
All right. So, what were some of the findings that you were having when you were doing your research? Like, what type of I mean, I would call it malpractice, but mistakes. What are common mistakes that are being made that are costing people their lives or costing them their health and well-being?
medication errors are probably the number one most frequent error. And now in nursing school, because no, doctors write prescriptions and nurses, pass out the medications or give the medications, right? They are taught the five rights: the right patient, the right medication, the right dose, the right route, the right time, all those things. And I think in today's world of craziness and chaos and understaffing, pardon me, they probably take shortcuts and skip steps. So that's one area. Diagnosis, misdiagnosis, or failure to diagnose, is another area of patient harm that occurs. For example, and I think I wrote this story in my book, there was a young man who had a brain tumor. And after the surgery, they told him and his wife, "Don't worry about it. It looked benign." Well, the pathology report came back with cancer cells, but it got misfiled somewhere. And 6 months later, this young man's coming back with, again, raging headaches. And now they see a tumor the size of the surgeon's fist, and realize that that true diagnosis, the pathology report, just never made it to the doctor or to the family. And that's one of the areas. One thing that's in the literature that really surprised me that wasn't in nursing curriculum and probably any other, health sciences curriculum, is a topic called failure to rescue. And what it is failing to recognize when the patient is showing signs of deterioration. These are all physiological signs. So, neurological changes, vital signs changes, ones we can observe, we can see them. And the literature tells us this happens 6 to 24 hours prior to an unplanned cardiac arrest. So if we're not teaching, and I say nurses because they spend the most time with
Other time.
patients,
Yeah.
yeah, at the bedside. If we're not teaching them to cluster or recognize and pay attention and be vigilant, maybe the patient's blood pressure 110/70 isn't concerning, but if we trend it and track it and see, an hour ago it was 140, so it's fallen, and
Mhm.
that's concerning, even though it still is in the normal range. So that's what I've been trying to do is educate around these clustered signs of be aware, make sure surveillance is happening, and then vigilance.
Yeah. I love that. I love that you share that because something in a non-emergency situation, and I encourage my clients to do this, is to go back and look at your blood work over a period of time. Like take those data points and track. Are you trending upward? It may be so minuscule that, you get your blood work back. Oh, you're fine. You're within range. You're fine. You're within range. You're fine. You're within range.
Yeah.
If you actually go back and look, it's going up or it's going down. And so looking at those clusters, as a natural health practitioner, and this is what we do. We look at the whole person and we look at all of these different elements, not just looking for the one thing. And I think that is very important for sure.
Yeah, you're right. Our bodies are so intelligent. Thankfully, we don't have to
Yes.
think about
Yeah.
all of its functions. But if we're not aware, you're right. Then those things, those signals, kind of fall by the wayside and we don't pay attention till it's
Yeah.
sometimes.
Yeah. Wow. Okay. So I had a couple questions that people wanted me to ask you. So these were two good ones out of the ones that we pulled. So the first question is if you had 60 seconds to give someone life-saving advice before they entered a hospital, what would that be?
Ask questions. Be an active participant in your healthcare, whether it's for yourself or your family member. If you sit passively in the corner and don't ask questions, don't understand, and just receive, then there is a chance that an error may occur or harm may occur, and it's never intentional, but it is a miscommunication, in fact, or communication breakdown. The Joint Commission tells us that 70% of patient harm events are due to communication breakdown.
Mm, yeah, I believe that. So what questions should they be asking?
What medications are you giving my mom? Or, what is this pill for? Can you help me understand what's it supposed to do? What are the side effects I should be watching for? Or if it's your dad, and you don't understand the doctor saying, well, their new diagnosis of congestive heart failure, we're going to do an echocardiogram and then we're going to put him on a diuretic. And this is all Greek to you or your family member, right?
Mm,
And not understanding so that you at least can go get a little more informed on your own, but having the basic understanding. Congestive heart failure is the pump, the heart, the ventricle is not strong. And so if we understand that part of it, that's why they're having trouble breathing. And then it's that clinical judgment or critical thinking of, oh, well, my dad's getting a lot of IV fluids right now. Would that be contributing to why he can't breathe very well?
mm,
Those kinds of things are just, again, not challenging, but working together as a partner with the healthcare
yeah.
team.
Yeah, so it's really asking questions to find for understand or to
Yeah.
find a more understanding. And yeah, I see, a lot with like clients will come in, they're on this medication with this doctor, this medication with this doctor, this medication with this doctor. It's like, do all your doctors know you're on all these different medications? And it's like, well, this one knows I'm on this one, but then no, I guess this one doesn't know. And then it's like, okay, have you talked to your pharmacist to ask if there's any inner, contraindications within the medications on their own? So I think oftentimes it's almost like people are just they're not I don't know if it's they're scared to ask, but maybe it is that they don't know what questions to ask. And, who are we to question a doctor because they're a doctor and they have all this education. So I think breaking the stigma of that in
Right.
asking questions is good. So I love that you have, yeah, asking like, what is this for? Why are you giving it to them? What is, what is this cardiac issue that they're having? How is that impacting them? How is that impacting their fluids? What's in the IV? What's in that medication? Yeah, these are great questions.
There is nobody that's gonna care more about your health or your family's health than you.
Yeah.
So when we realize how many patients doctors are taking care of and how many opportunities for missed information, communication, whatever,
Mhm.
and that's why I also recommend if anybody's going to the hospital, take a notepad,
Mhm.
write things down.
Yeah.
It's easy to be overwhelmed, but if you can flip back and say, "Oh, well, the doctor yesterday said we were gonna do this. When is that gonna happen?" Or and it's not to be controversial, it is really to partner. But you're right,
Oh, yeah.
I truly believe we've gotta change the culture of healthcare because, yeah, our parents, the doctor says and the doctor knows. Well, not necessarily. When you do a little research and you find out that maybe there's 5 different ways to treat something, as you know well,
Yeah.
and maybe we want to explore all of our options before we just agree and nod our head.
Yeah.
You know what? Get a second opinion. If they say you need surgery, or even if they say your tests say you have cancer.
Mhm.
In fact, I did a social media a couple months ago about a doctor in Montana, I believe it was, who was treating several of his patients, but the one in the news was a young man who'd been getting chemotherapy for 11 years, never had cancer.
That same thing happened to my best friend's mom from
Oh my gosh.
yeah, it happens. Like, she literally went through cancer treatment, and her cancer was not back. It was a lesion or something from the previous cancer that she had gotten rid of years prior. Yeah, I mean, it's wild. Yeah, you're right. Second opinions are even third opinions are so important. Um, and I think also when it comes back to, like, the questioning and, like you said, bringing a notebook, to the doctor's office or to the hospital, because what I find is, um, my parents are aging, and then, I mean, my grandma's still alive. My mom's the oldest of 8 children, and guess what? They're all participating in the care for my grandma, and she's in a home. And there's a lot of, cooks in the kitchen, if you will. And
Yeah.
so there has to be clear communication from one kid coming in to them leaving to the next kid coming in and the nurse coming in. And there's all of these things. So definitely we could do a much better job.
One of the other chapters I have in my book is how to pick your provider, your healthcare provider, and treat it like an interview. Your healthcare provider should respect you, should have a two-way conversation, not just talk at you. And if you say, I'd like to get a second opinion, they should support you. And if
Yes.
you get any other reaction, I would say that's not the person I want treating me.
Yeah. Yeah. No, that should be a red flag for sure.
Yeah.
Yeah, actually, the more data, the more information we can get, the better, because I always tell our clients, like, not one person can know everything, right?
No,
I mean, we
no, that's
can't, like,
over.
it just doesn't happen. Okay.
Well, medical knowledge, I mean, it has sped up so that wasn't correct English. A decade ago, it was in doubling every 3 years, and I think it's down to now doubling in less than a year is the
Mhm.
most current data. So, you know, you're right. Nobody's gonna know anything, and I would much rather have a physician say to me or any healthcare provider, "I'm not sure. Let's go look it up together," or "Let's find out."
Yeah. I think that's where, like, AI is gonna come in and be really helpful for us.
Yeah.
It already has. I don't remember. I think I was listening to a podcast, someone talking, and they were talking about a rare disease, and what they did is, and maybe it was a news article I was reading, but what they did is they put this disease in AI to find out what does the research say? Where has research been done on treating this? What types of treatment? And it came up with these different studies from all over, and it computed into these different things that someone
Well,
could do for this rare disease. And they actually found a solution to treat it. So, I mean, I think the like AI in such a great way is going to help people, be able to work with their doctor and also say, "Hey, what about this?" So I think there's some really good things that are gonna, come from it,
I
as
do
well,
too.
you know?
And one of the best AI research tools that has so many studies in its database is Perplexity. I don't know if
Oh,
it's
I never heard of that.
perplexity.ai or .com, but it is amazing. It will give you, and you can even put in there, give me citations only within the last 5 years. So it's recent, but it's amazing.
Yeah. I'm writing that down, I'm gonna go check that out. I love that. Alright, um okay, well, the other question, I think you already answered that, is what is the most common mistake you see being made and how can you prevent it? And that was the lack of diagnosing or the not diagnosing, and then the medications.
Mhm.
And so,
And then failure to see signs of deterioration. So as a family member, because anyone that's gonna be deteriorating probably isn't gonna be up to looking at their own numbers on the monitor, right? They're not gonna feel good and but looking at, again, what is the trends? If you see, your mom's heart rate is 100, which is borderline normal, but in 20 minutes or an hour later, it's 110,
mhm,
something's not right.
mhm,
Or, the nurse thinks your mom is always confused and you're like, no, this is not
yeah,
her baseline. This is not her normal. And that's why I teach the cuss words. And that is those clues or cues that you can use to get the healthcare team's attention. So the C is concerned. You could say, my mom's not acting like herself. I'm really concerned. U is uncomfortable. My son's pain is really making me uncomfortable. This just does not seem normal. And then the S, it's, I'm scared. I'm really scared to see my husband out of it like this. This is unusual and it's scaring me. And then next is, this is a safety concern.
mhm,
I don't think this is a safe state of being for my family member to be in. Or, if the nurses can't even come in and see him when he calls for help, that doesn't seem safe. What can we do together? And again, it's not to be threatening, but it's just saying, I
yeah.
need attention because something isn't right.
Yeah. Yeah. Absolutely. And I think it's so important that we do speak up and that we ask the questions and there's no stupid question in any of these situations. I think sometimes people just get put off by the way that if they do ask a question or say something, the way that they're treated, because there is, I mean, in my own experience, I've had many run-ins with the medical industry. And I think God did it to me so I could do what I do now in such a great way. And I always say, like, there's a time and a place. I mean, Western medicine has come so far in terms of emergency care and keeping people alive. And you have seen it like
Uh,
in the forefront, right? Like the beauty
yeah,
of medicine and saving people's lives. But there's also the other side of it, that is the preventative and the maintenance stuff that we need to be doing, and that doesn't come from the Western medicine vein,
right.
you know,
Not at all.
and we need to quit pretending like like it does. But there it's definitely questions need to be asked for sure. And I think if anyone's getting anything out of this podcast, I think it's like, you could even go to AI and ask like what are important questions for me to ask when my loved one's in the ER. uh,
Yes.
and take that notebook, take that list, of questions and bring it in and don't back down on asking these questions because it, you you need these answers.
Yeah,
It's
you
literally
have
life
to.
and death.
Yeah, you have to take this active role in yours and your family's health. An example of what you talked about too is there's an organization that talks about there's a nonprofit organization, and every year they rank the 10 top safety concerns. Last year in 2024, it was that where practitioners were not ready for practice.
Mm,
So they were, and I can attest to that. We can talk about that in a minute if you like. But practitioners weren't safe and ready for practice. And there was this gap between finishing school and getting their license, nursing license or pharmacist license or whatever, and beginning practice. So that was 2024. But 2025 is the number one patient safety concern is healthcare providers, nurses, doctors, everybody in between dismissing patients' concerns. And so speaking up is the first part of it, but the second part is you must escalate. So if you get blown off, dismissed, gaslit,
yeah.
which does happen, then you must use the chain of command. So in the hospital, you've got your nurse, then there's a charge nurse, there's a house supervisor, there's a medical chief of staff, and there's a hospital administrator. So go up the chain of command with each one of those till you get resolution.
Mm.
Some acute hospitals also will allow the family members, give them the phone number, the in-house phone number to the rapid response team. So for example, if you noticed your husband's mental status deteriorating and now you can't wake him up and you can't get anyone in there, call the rapid response team yourself.
Mhm. Yeah. Wow. So why do you think there is that discrepancy going on now? I mean, I, well, first let's back up. How do you think we got here? Like because if we go back even, 100 years ago, if we go back 80 years ago, doctors would show up at your home.
Right.
They were like a part of your family. They would show up and they would give you care. Um, like, at what point do you think that we have gone so far the other way from giving, like, good quality care to, like it's almost like I call it the Amazon mindset or the fast food mindset where, like, you're in and out, in and out, in and out. How much can we get out of this? Um, where did you? Because 'cause you've been in the industry for a long time, where is there a time frame where you've seen a big shift or anything that stands out to you?
Yeah, in the 80s, when President Reagan was in office and the changes went to for profit,
Oh, yeah.
really believe that was the beginning of the challenge. And then there was a bunch of things that changed in the legislation too, with reimbursements and all those things. I was just reading an article a couple days ago about the threat of so many rural and safety net hospitals closing
Mhm,
because the reimbursements from the government aren't keeping up with inflation. And now we're looking at potential cuts for Medicare, Medicaid. And these hospitals, most of them are razor thin operating margins. That's part of it. But also, when these private equity groups came in and started buying up hospitals, and they're in it for the profit only.
mhm,
Um, there was one in 2010 that bought up like 8 hospitals, and what they do is they cut the resources to increase their profits, and then they sold the land out from under the hospital, and the new owner raised the rent, so to speak, on the hospital, and now they're operating at a deficit. So,
mm.
I know that was a lot, but I think when we put money in it.
Yeah, follow the money always.
Yeah. Then there's some people that just take advantage of a system where they can actually make money. We
Yeah.
have pharmacy benefit managers, which are the middlemen between insurance companies that are supposed to negotiate for better rates. They pocketed, I want to say $4.7 billion over and above And that was only in the last, like, 4 years. So, there is a lot.
Yeah, it's been confusing to me because like the hospitals in our community here, you have Mercy, you have Dignity Health, you have Adventist Health. So you have these big hospitals that are not for profit. However, their logos are on, big buildings in terms of like Dignity just, put their logo up on the where they have concerts and, events at this big event space, right? This is, I mean, I don't know, probably hundreds of thousands of dollars to get their logo up there. And I'm like, how is a nonprofit able to come up with hundreds and hundreds and thousands of dollars for advertising? Or like I go to events and it's like my company can't, to afford to be like the main sponsor of this event is 30, $40,000. But these nonprofits that are hospitals are the main event sponsors. And it's always confused me as to like how is this working when you're a nonprofit? Because when I just got off the phone with a nonprofit that I'm going to do a talk for the kids in the nonprofit in the summer. And like they're like a real for real like nonprofit. Like
Yeah.
they're, like, trying to figure out ways to make some things happen, and, so that part to me, when you say for-profit hospitals and not-for-profit hospitals, what's the difference there? I mean, I know it's a 504(c)(3), but, like, from my point of view, I'm looking at these nonprofit hospitals where I live, and I'm there's no way they're not for profit. Like,
Right.
how can this be?
So, I don't know that much about nonprofit. What I do know is you can pay your people, like your CEOs and all that, really well, like a
Mm.
lot of money.
Yeah, and still be a
Um,
nonprofit?
and still be nonprofit, and you can still make money being a nonprofit.
Mm,
So, I know there's specific guidelines, I just don't know what those are.
yeah.
Yeah, but it's, we're really in a precarious situation in healthcare today, and so as you alluded to earlier, stay as healthy as you can
Mm,
to avoid being in the hospital system. Unfortunately, we're all gonna know someone, a loved one, a friend, a family member that will be in the hospital someday.
yeah.
Hopefully we won't, be in that situation, but I always say be informed and get educated as best you can
Mm,
before that, maybe comes into, your experience.
yeah, for sure, and I mean, as we're talking about this, I do wanna throw out there, like, there are I mean, I've had 2 children, I had some nurses and some really great experiences, so and again, this isn't, like, across the board, but I do think it's like, "Hey, we need to be informed and ask questions," and there is some stuff that we all need to question. I do wanna go back before we close up and on the piece where you were saying that you've noticed, like, in 2024, there's, like, this gap between entering the workforce and actually being prepared. So what's going on there?
Well, I can speak from the nursing world for sure. When the pandemic happened, we had to go to virtual training. And so
Oh,
luckily the boards of nursing let us kind of fill in the gaps. And because we know that we still needed to get through nurses through the nursing program to
yeah.
become nurses, we're still short staffed out in the world, 100,000 and more retiring, et cetera. So that was a problem. Um, so there was a study. Do we have just a couple more minutes?
Yeah, yeah, yeah.
There was a study back in 2006 that took 5,000 new grads of nurses that passed the NCLEX and got their nursing license, and they did a 5-hour exam. It was application-based, not just a written, so a combination of both, and they found that only 35% were practice ready, safe, and competent. They repeated it in 10 years later with a new group, over 26 states and 41 different nursing schools, and it had fallen to 23%. Well, after the pandemic, so in 2021, just a year of, virtual learning, and some students didn't get to go to clinicals and get any hands-on
Oh.
experience.
And they could still become a nurse without
Yeah.
clinicals? Oh, wow.
Well, they did virtual clinicals, so simulations
Yeah.
online, etcetera. But that practice ready safe percentage fell to 9%.
Oh, wow.
So, and still being in nursing education, we have a lot of students that work full time that have families, and some of them don't have the integrity and they find really creative ways to cheat.
Yeah.
When I'm have them in my office and say, "Come on, what's going on? Why did you do this?" They'll say, "Well, I'm working and I need to pass this course and I, need to get a job." And I said, "If we were in art school and you were gonna open a museum here in Washington, DC when you got out of school, I could care less if you cheat. You've got patients' lives that
Yeah.
you're gonna
Yeah.
be responsible for." And I don't think it just computes. So I think there's a multitude of reasons. The NCLEX also changed in 20, gosh, we're now looking at 2 years ago. And they now give credit for partially correct answers
Oh,
versus before you had to get it all right.
right.
So I think there's several factors going on.
Yeah, I think it's lowering the bar. I mean, we've
Yeah.
been seeing this happen in our school systems, K through 12,
Yep.
for a while, and I worked in K through 12 system for 18 years, so
Wow.
I can say that from experience that, it's like, "Oh, just pass them. They just gotta get by, like, let them." And it's like, how much more are we gonna lower the bar in this country in different areas? I mean, because it comes at a cost, and
Yep.
unfortunately, in your industry, this is life or death.
Yeah.
That's scary.
One comment I want to make to what we were talking about earlier is sometimes when healthcare providers, and I'll just say nurses, because I've worked with many more of those, I've worked with doctors too, but they will get a little bit of a cranky attitude when they don't know the answer.
Mm,
So if you ask them something, they could either try to make it up. And again, you're right. We have so many healthcare care providers that really care, really do a good job. But we just have to have our antennas out for those that we have to not take them at their word and do our own research and double check. Uh,
yeah.
and I do want to say too that I am very hopeful. I really am. I know that we can turn this around, but it's really gonna take a grassroots to get effort to get everybody as spread this message as far and wide as we can to be informed and educated. That's how things are gonna change when we demand the safety, when we demand answers and just say, "We're in this together." We both want the same outcome.
Yeah, yeah, for sure. I mean, I've been saying that for years that we need to demand better customer service within our healthcare system.
Yeah,
And customer service comes with listening, with allowing people to feel like they can talk to us, they feel like they can ask the questions, and that's so important, like, so important.
it truly is. I'm getting ready to give a talk a couple weeks in San Diego, and that's what I'm talking about is the true listening because the family members know that patient better than the nurse.
Yeah,
Oh, hey, if mom isn't acting right, then we as healthcare providers really need to listen and partner, as I've said before. But it truly is going to bridge that gap to we're on the same team, right?
mhm. Yeah, absolutely, absolutely. I mean, we all are on the same team, and I think, when it comes to healthcare, when it comes to our family members, like, we all want health and vitality and to feel like we're being taken care of and support, and we don't wanna be scared, we don't wanna be fearful, we don't wanna feel these things, but it takes all of us communicating in an effective manner to
Yeah.
do that, so well, Dr. Julie, thank you so much, for your time today, and thank you for the work that you're doing. I think this is incredible and in giving people those tools and resources. Can you share with everyone the name of your book and where they can connect with you and find out
Sure.
information?
Sure. My book is on Amazon, Surviving Your Hospital Stay, a nurse educator's guide to staying safe and living to tell about it. And then my website and socials are drjuliesiemers.com. And on there, but I can give you the link too, I have a free patient safety guide. So you
Mhm.
can click on and just download if you're going to the hospital, kind of what you should know, what you should ask, that type of thing. So
Awesome. Yeah, we'll add that in the show notes and we'll add your links as well in the show notes. So
awesome.
thank you so much for joining me today. And yeah, I appreciate the work you're doing.
Thank you.